Welcome to this spooky story about a nurse's experience working in a secured facility for elderly patients. As the majority of patients don't sleep, the facility tends to be busier at night, making it the perfect place for strange occurrences. The nurse noticed that some patients were talking to the wall or acting as though someone was in the room with them, and even mentioning the names of the ghosts or spirits they were communicating with. What happened next was truly unsettling. Let's get started. The haunted nursing home. I have no prior experience when I first get out of nursing school. I'm not wanted by any employers. However, I discovered a location in the countryside. The road is a farm road. People with severe dementia or Alzheimer's disease should go here. A person with this brain condition will gradually begin to forget things. Due to the patient's constant wandering or erratic attempts to flee, this is a locked unit. Since these patients never sleep, nobody wants to work here at night. They constantly move around. Their brain never turns off. These people's bodies and brains are constantly inquisitive, despite the fact that when you go to sleep, your brain sort of shuts off. It's typically busier at night because there are fewer employees working there, and because the majority of these patients don't sleep. The majority of these elderly patients had passed away in the secured facility. Like their spirits had never left the location, it seems. When I first began working there as a nurse, a few of my patients would occasionally talk to the wall or act as though someone was in their room with them while no one was actually there. What's unsettling is that patients occasionally mention the name of the ghost or spirit they're communicating with. When Albert wouldn't let him eat his dinner, one of my patients would keep complaining to me. I played along and pretended to be in charge so that he could eat his dinner. This was something that the patient repeatedly did. I once questioned a long-time CNA there about why a few patients kept bringing up Albert. The CNA informed me that Albert used to reside there in room 2, but passed away 4 years ago. Sometimes these patients don't know what they're talking about, but other times they're quite normal and you can have a casual conversation with them. I went into a patient's room once to administer medicine. Jana is the name of this patient. The dementia this patient has is mild. The patient I was treating once looked up as I was giving her medication and said, "James, what are you doing? Stop bothering my nurse." I turned to look at the room and behind me. Nobody appeared to me. I inquired about James and his whereabouts from Jana. "James enjoys touching people's hair. James enjoys touching people's hair," Jana informed me. Many years ago, he resided in this space. I got goosebumps all over my body when my patient told me this. My hair is starting to stand up. After watching the patient swallow all of the pills, I went back outside. Jana's daughter came and took her home to New Jersey a few weeks later. After that, we brought a patient by the name of Cian into that space. Cian had been working there for a while, but because of his rudeness, he didn't get along with anyone. He was moved into that room by us. Cian was slouching on a couch in the activity room when I discovered him one night at 1 in the morning. "He should go to his room and sleep," I told him when I woke him up. "James, his roommate is being cruel to him," he declared in a fury. Hearing this made me feel even more frightened. No one wants to work there, and especially no one wants to work at night. So it makes sense. Many CNA who work nights have grown accustomed to it. They all claim that many spirits still exist who never passed on. We hired an old CNA named Kathy a few months later. One evening, it was chilly and snowing outside. Our patient is on the verge of passing away. To help the dying patient's breath slow down, I administer some medication. Her pain is also relieved by the medication. She needs to be kept warm in bed so she can pass away quietly. But as soon as Kathy entered the room, she opened the window. There was cold. Why did she open the window? I questioned her. She promised to inform me to leave the window open when we leave the room. As soon as we were outside, Kathy informed me that after someone passes away, you must open the window to allow the soul to leave. Kathy practices and believes as a Catholic. We already have a lot of inquiring spirits inside the building, so I hope Kathy is correct. Opening the window might encourage the soul to leave rather than stay. Thank you for listening to this eerie tale. Working in a secured facility for elderly patients can be a unique and challenging experience. It's fascinating to hear stories of ghosts and spirits that seem to linger in a place long after the people who live there have passed away. Do you have any ghost stories of your own? Share them in the comments below. And remember, if you ever find yourself working in a facility like this, be prepared for the unexpected.